Peripheral chorioretinal degeneration, mucopolysaccharidosis, inherited defect in catabolic lysosomal enzymes degrading the following glycosaminoglycans: keratan sulfate, dermatan sulfate, and heparan sulfate. Accumulation of incompletely metabolized acid mucopolysaccharides and/or complex lipids in lysosomes. It is autosomal recessive. Hunter's mucopolysaccharidosis type 2 is X-linked recessive. Sphingolipidosis, enzymatic deficiency with resultant glycolipid accumulation in brain and retina. Tay-Sachs disease, GM2 gangliosidosis type 1. GM2 ganglioside accumulates in ganglion cells. There are multimembranous inclusions, zebra bodies. Fundus shows cherry red spot. There is mental retardation. Chloroquine bullseye maculopathy, microscopic picture. Primary effect on retinal pigment epithelium, with drug stored in melanin granules to have a prolonged effect. Diffuse mottling of the central area. Pale ring. Atrophic retinal pigment epithelium forms and surrounds the central focus. Attenuation of retinal vessels. Loss of ganglion cells with bullseye maculopathy. Visual field. Bilateral paracentral scotoma, more to red test object. Constriction of the visual field. Paving stone cobblestone degeneration. Flat, sharply outlined yellowish-white lesions seen at retinal periphery. Affects 27% of population older than 20 years. Common in infratemporal quadrant. Peripheral choroidal vascular insufficiency, aging. Outer ischemic atrophy of choriocapillaris, retinal pigment epithelium, and outer retina. Intact Bruch's brain. Hypertrophy and hyperplasia of retinal pigment epithelium at margins. Lattice degeneration. Sharply demarcated, circumferentially oriented areas of retinal thinning. It affects 6 to 11% of population, around 7%. Anterior to equator, vertical meridian, supratemporal, and bilateral. Secondary retinal pigment epithelial proliferation, only 12% of lesions have white lines. Microscopic picture. Infratemporal location. Posterior end is post-equatorial. splitting in outer plexiform layer, filled with hyaluronic acid. Inner layer formed of internal limiting membrane, inner part of Muller cells, nerve fiber layer, and blood vessels. Shows tiny yellowish dots. Neural retinal holes, small in inner wall and large in outer wall. Reticular retinoschisis, split of neural retina at nerve fiber layer. It affects the infratemporal retina in the fifth decade of life. Microscopic picture, holes may be present in outer wall, inner wall formed of internal limiting membrane and nerve fiber layer, outer wall formed of photoreceptors, outer nuclear and outer plexiform layers.